Governor Pritzker saying the state is ramping up testing.
But tonight there are concerns about a COVID-19 test that's giving false negatives. WGN's Megan Dwyer has details on that. Megan?
Micah and Joe, the governor said 26,000 people were tested for COVID-19. That was just yesterday. But 3,000 of those 26,000 tests are potentially problematic because they were developed by Abbott Labs. And now the state is having to take a second look.
The U.S. Food and Drug Administration issued an alert yesterday about the accuracy of Abbott Labs' rapid COVID-19 test. The test is called the ID Now test. It's been used to screen White House staffers. Turns out it has also been used in nearly 10% of the tests run in the state of Illinois so far.
We've all been put on warning by the FDA.
Despite that, the governor says we are still on the cusp of moving to phase 3. In the last 24 hours, only 9% of the people tested in Illinois have been positive.
The great news is that the positivity rate in Illinois is coming down.
Illinois is testing 4.7% of the population per month. The federal government recently called on states to test at least 2% of the population. Right now, Illinois is averaging about 20,000 tests a day.
We're finding more people are positive here. But that doesn't mean there aren't a lot of people that are positive in other states that aren't being tested.
The governor says he's worried about people crossing the Illinois border and coming from states that are opening sooner, like Iowa and Indiana and Wisconsin, and could infect Illinois residents, but says his family on a farm in Wisconsin should be off limits.
You know, I've been very private and reserved when it comes to my children. And it's because there are threats to my safety and to their safety.
As for the much criticized antibody tests, the state says it has convened a panel of experts to try to figure out official guidance and which tests might be worth taking to see if you could be immune.
It's not clear how long that protection would last. It's not clear the level of antibodies that would be protective. So I think there's more questions than answers at this point.
Today, public health officials also encouraged and advised all hospitals to test pregnant women for COVID-19 before they give birth. That's not just to protect healthcare workers at the hospital, but also to protect newborn babies. I'm live tonight at home. Megan Dwyer, back to you guys.